mental health tonight. Mixing holiday drinks with medication. It can cause big problems if you're not careful. Here to explain is Dr. Varsha Radhakrishnan, a psychiatrist at Tufts Medical Center. Good to see you, doctor.
Good to see you.
As you know, many people typically drink more and more often during the holidays. So what are some of the challenges for your patients who are taking drugs to maybe treat anxiety, depression, other conditions?
So as with most things, it's important to consider, what are the potential interactions that alcohol can have with medications? Is that something that's safe to do? It's always important to ask your doctor. Alcohol can also independently make your mood symptoms worse, potentially. It can make it so that your medications are less effective. The other thing is many of us are on different medications. So if you're on medications that are more sedating, especially when combined with alcohol, it can lead to really dangerous things like respiratory depression or increase the risk of severe intoxication, motor coordination problems, and so forth.
So can I ask, is it safer to stop taking medication if you know you plan to drink?
So many medications may actually work less effectively if you stop and start them. I would not recommend starting and stopping medications in anticipation of drinking. It's important to always check in with your doctor to see whether or not medication in and of itself is safe or not to drink with alcohol, but starting and stopping medications may make it less effective, may make your mood symptoms worse. It could even lead to withdrawal symptoms that could be life-threatening.
I know one of the most prescribed medications in the country is sertraline, which, many people know it as Zoloft. It's used to treat depression, anxiety, even panic attacks. Can patients take that drug and still have wine with dinner, maybe?
So Zoloft in particular, among many other antidepressants, is in the class known as serotonin reuptake inhibitors. So these medications are generally relatively safe to take while drinking alcohol. They're not known to cause any kind of major or life-threatening interaction. But of course, as I mentioned, anything in moderation, that's the most important piece. And that being said, folks on Zoloft tend to also be on other medications that might be sedating. So it's important to always check with your doctor first.
Important information, Dr. Radhakrishnan. We appreciate you. Thank you.